has ectodermal dysplasia. I just saw him. I've never seen that much tartar on teeth in my entire life. That's not even one. Look at this. And somebody felt sorry for him. He went in to have a crown because he has no enamel on his teeth. And they gave him crowns on all his teeth for free. But nobody's maintained them. So he needed to lose that tooth. I went on ahead and prepped that tooth and made him a temporary, then sent him to Dr. Gifford. This is a case where she didn't come back to remake these temporaries for 3 years. There was an implant on the number area, and an area of number 8. It was 4 millimeters into the mucogenital junction. The periodontist went in, removed that implant, and thought we'd still make a success with this implant. Well, we're starting to get into problems now because you can see the difference in the distance, the vertical height of 7 and 10. And now we have decided to take out that implant and start all over again. And only place one implant. But you get any cases like this, she's only 35, attractive female. And the dentist that put this in, put the 2 implants in, and the one that was in number 8, once again, I said, why did you put it in this area? It's unrestorable. She said, that's the only place I have gone. So for God's sake. Trying to repair things of this nature is just terrible. Can we stretch tissue, Dr. Gifford? No. So that's my best attempt to look at this. I mean, the nice thing when you start taking pictures like this, if you can put this up on a grid before you even touch the patient, you are forewarned and forearmed. Because many times you don't see these discrepancies until after you made the mistake of trying to restore it in normal fashion and didn't see the discrepancy from one side to the other. This is Svetlana. This is what I got. Look at the endos. Those have been problematic. I could not find out what type of implants those were on the upper left. Upper right were brown mark. I don't know, anybody, there are a few of us that are old enough to remember what bladed implants look like. These are still integrated. So we started on her, we had this discrepancy, terrible inflammation. Oh, and I'm going, oh my God, what am I going to do here? So I took all those crowns off, and then I just, this is crazy. We haven't even dealt with that. I made coatings on the upper left to deal with the coatings. I mean, I put coatings on the coatings that she had remaining because I couldn't figure out what to order. And then we had to deal with the front. These were the coatings I tried in. That last one on number 15 is so short, I can't even believe it stayed on. And she's got secondary decay, irregularities, chipped porcelain, poor occlusal pine. So we began taking things apart. And these are terrible buildups. But in Russia, you know, you no telling what you have to deal with. That was all the new coatings and the coatings prep, temporaries. But you get into these situations and you look at the gingival, and you go, you're right, thank God, you know, your tissue type and your lip line are your saving graces. She has thick enough tissue that you wouldn't expect a lot more recession, but she does a lip line that doesn't show the discrepancy. And I knew those endos were going to give me problems over time. And eventually, getting some duplications here, Doc. All right, come on. We're going to do it this way. I have to admit, since she's been with me, I think she looks better. What part of Russia she's coming from, but I sure like it. She's a sweetheart. But I knew the endos were going to give us some time and trouble, and sure enough, this is number 10 and officially starting. So she ended up losing 7 and 10 implants placed at the same time. I like the way number 7 turned out better. She, being the tall, attractive blonde that she is, didn't want any black triangles. So when I fill that up, sometimes you can pinch that tissue out and cause a, I mean, you can only deal with tissue in approximately as long as there's bone. If there's no bone, there's not a lot of magic you can do with that in trying to get that papilla to come up. Once again, I hate this discrepancy, but it's the best I can do. This is a case where she had pemphigoid. So she wore temporary dentures for 6 months. These were closed tray impression fillings I got away with. It was so hard to take impressions on her because anytime you put something in her mouth, she had blisters. I don't have pictures of her provisionals, but wherever anything touched tissue would just slough. And I don't know if any of you have seen pemphigoid or pemphigus. No citrus, no spice, no nothing. And we were going to do a cementable case. If I did this case differently now, I would do screw retain, just because I want to make it retrievable. This case caused me a lot of grief because I cemented the maxilla and it came out and she broke it, and I didn't realize how bad she broke it, and I put it back in her mouth, and I spent the next 6 months trying to get it out, and eventually cut it out and start all over again. The mandible. And when you do cases like this, these are all custom buttons. I don't know why they have to make them so sharp. I mean, but you can see that there's not a lot of tough tissue in this lady. She had bone grafts with bone morphogenic protein, growth hormone, and stem cells. We got bone here, and this woman is a recovering alcoholic, still was smoking a pack and a half a day that I wasn't aware of. And I haven't seen her lately. Lower. That's a lot of checklists. On a case like this, I just soon do something with plastic. I could make it look a whole lot better. I mean, you could have gone back in now. If you're going to deal with pink porcelain, you can get GC's staining kit for composite, and you acid etch pink porcelain, and you can stain pink porcelain to a point that it almost matches the tissue perfectly. You just have to be able to feather it out and get it to blend, and then with the tissue. When I was down in Phoenix for a week, I saw some pretty incredible dentistry being done, and now the advent of computers and scanning. They're doing a metal substructure that had been scanned, that screwed to place, that then had a Piers-like zirconium substructure with pink porcelain screwed to place on that, with individual abutments, with individual Emax crowns cemented on this case.